Pivoting WASH responses towards more comprehensive public health programming anchored in community engagement. Thank you for the opportunity to be presenting at this year's Emergency Environmental Health Forum and discuss Oxfam's current work on thinking about how to support WASH actors towards a more comprehensive public health programming. Urbanization, climate change, and their associated impact on overcrowding and displacement increase the chance of new diseases as well as transmission once a disease is in circulation. Poor urban planning, overburdening of health, water, sanitation, and support systems reduces the capacity to adequately tackle new or resurgent diseases. Climate change is also affecting access and control of resources, think most particularly of water, and increases the risk of conflict. All of this places an additional strain on systems and restricts access to them by the communities in need. Globally, epidemic diseases remain a leading cause of death and suffering, and this is always compounded in humanitarian and fragile contexts. All of this highlights the importance for WASH practitioners to learn to be more flexible and pivot WASH-focused hygiene promotion work to be more comprehensive preparedness and response plan for infectious diseases. I want to give you all a heads up. The recommendations discussed today are not new. The question is, how do we need to work differently through a community engagement approach to ensure that we internalize the agility and flexibility needed to respond to outbreaks beyond traditional WASH diseases? How do we make sure that these capacities can become a core part of our hygiene promotion component of our humanitarian WASH response? In 2019, during the Ebola outbreak in Eastern DRC, Oxfam facilitated the setup of community committees in Butembo that met on a regular basis based on their community needs, the epidemiological situation, and security assessments. Oxfam provided support through continuous training and access to accurate and relevant information. These community committees, with the support of Oxfam teams only when necessary, were able to identify the key barriers to eradicate Ebola based on epidemiological trends and community feedback in their locality, map out community action plans to outline practical solutions to address the identified barriers. This helped lower tensions and violence that was taking place between communities and Ebola response teams. Another example is in Lebanon. During the COVID-19 outbreak, Oxfam and their partner NABAD developed a vaccine promotion plan. The action plan is in part anchored in the feedback collected through the Community Perception Tracker, which you'll be hearing about as well over the course of this forum, which enabled them to understand that the additional burden of needing to travel distances to vaccine sites was a barrier for certain Syrian refugees to access the COVID-19 vaccine. Oxfam and NABAD were able to increase vaccine uptake by providing a transportation allowance, covering the trip to and from vaccination centers for those who needed it. Over time, oftentimes the most assumed barrier is people don't know what to do or where to go, and we limit our hygiene promotion work to direct messaging and directive messaging. This does not help individuals surmount actual barriers they are facing. In Eastern DRC on the Ebola response, as well as Lebanon responding to COVID-19, the impact of joint public health and protection programming aimed at preventing disease outbreak was impactful through variations of community action plans as they help ensure a targeted, adapted, and bottom-up approach. The aim of hygiene promotion work through a community approach in epidemics means enabling communities to contextualize and take ownership of any preventative measures put in place by governments, epidemic response teams, or other authorities. In epidemics, the roles of hygiene promotion teams need to expand to systematically include facilitate coordination between communities, health systems, and authorities by providing accurate and responsive information, creating space for participation as supporting increased community confidence in health services. This can include, but is not limited to, the provision of WASH services in these facilities. In terms of hygiene promotion activities, it means ensuring a better understanding of how to increase our understanding of health-seeking behaviors at a community level and increase acceptance of critical response mechanisms. Depending on the disease outbreak and the context, this can include surveillance, case management, vaccination, etc. All of this is done with the aim of strengthening a bottom-up approach and equipping high-risk population groups with the ability to prevent and reduce the risk of transmission. Based on Oxfam's continuous work on epidemic responses, Oxfam's public health team is designing a tool to support in going beyond hygiene promotion for WASH-related outbreaks and feeling comfortable rapidly upscaling flexible prevention work for a variety of different types of epidemics through a community engagement approach. It will be an addendum to Oxfam's introduction guidance document to community engagement in WASH, highlighting additional considerations for tackling an epidemic. For today's presentation, I want to pull out a few examples from the 3 key areas where this shift needs to take place. First of all, expanding our understanding of what is needed in a context analysis. Second of all, ensuring continuous capacity building for program staff as well as community members and community volunteers. And third, coordination. As a WASH actor, we are not medical actors. We are providing a linkage with services that in the context of an outbreak, people oftentimes distrust. Coordination and sometimes advocacy towards medical actors is mandatory. All these 3 aspects work together. When responding to epidemics, there are other considerations to take into account alongside a regular community engagement analysis component. This includes, but is not limited to, the transmission pathways, specific risk factors, seasonal calendar impacts on outbreaks, history, both in terms of recurring diseases in the region or the country, as well as successful disease management or traumatic collective experiences with past disease outbreaks, as this will affect how communities respond. Existing biomedical and informal health infrastructure, EPIDATA, and the importance of triangulating that with context. Programming. All our hygiene promotion work is only as strong as the teams who are rolling it out, within our organization as well as at a community level. Systematically ensuring the appropriate support to staff, partners, and communities across a response will help strengthen their capacity to respond effectively to disease outbreak. As humanitarian actors, we need to collectively agree that capacity building is more than a training. It's a collaborative approach to enable people to gain skills, and with those skills, be able to create change. In the context of disease outbreak, especially new diseases, training, access to information needs to go beyond an overview of the disease. Training needs to enable staff and communities to facilitate with confidence discussions around, for example, transmission pathways to support communities in adapting top-level prevention actions to what is possible in their context, or epi trends with context analysis to understand who is most at risk. It's important to remember that to speak with confidence and to build trust with those you are communicating with, you need more information than what you are providing. The best people who are communicators are those who are knowledgeable about the issues they're going to talk about. It's not about reading talking points or having messages. It's about being able to understand the 9th question, being able to explain details of the information they're sharing. Hygiene promotion teams need to know how to explain things differently as opposed to how to repeat information. In terms of external engagement, collaboration and coordination are a key aspect of what we need to be doing better and more effectively in disease outbreaks. Epidemics begin and end at a community level. Responses need to be centered around communities' needs, beliefs, and actions. WASH actors with a strong community engagement approach in their hygiene promotion work are, at a community level, working on supporting the adoption of preventative measures or adapting those that are not realistic for effective communities and finding appropriate solutions. Coordination on activity, content, and rollout is primordial. Our presence in coordination meetings on referral pathways, alert systems, or health outreach activities with biomedical actors is necessary. We need to be working as WASH actors with medical actors on harmonized approaches and on harmonized information that we're sharing. Coordination in strategic preventative approaches is also a key place where we need to be at the table and advocating. Sometimes this can be around contact tracing, strategies for contact tracing, or around, for example, cordon sanitaire or quarantine policies. We also need to be present and active in coordination on national, regional, and global platforms for actions such as linking with resources and work done through the RCCE platforms. At the moment, there's a disconnect between the participation of WASH actors and biomedical actors, and both of us need to be present and actively participating within these coordination systems. Prevention is just as, if not more important than treatment. In prevention, trust is the leading parameter for measuring impacts. Teams who are able to conduct strong context analysis and support adaptation or adoption of preventative measures and access to treatment are able to build trust and co-create a response plan that works for and with communities to break a chain of transmission. At the same time as humanitarian actors work on ensuring we have the skills and tools to pivot existing programming to respond to disease outbreaks, various types of disease outbreaks, community engagement needs to be considered as a way of working between humanitarian actors and not only how actors work with the affected population themselves. Thank you very much.